Hi all, welcome again to Yoke's YouTube channel. I'm Liz Matthew, the licensed Canadian immigration consultant, and nice to have you all here. So today we will be looking at NOC codes. How do we select that? It's a very commonly asked question. I'm not sure if this is my right NOC code. What NOC stands for is National Occupation Classification Code. So each job occupation in Canada, say you apply for your permanent residence or to get an employment letter, you got to have your duties and responsibilities stated out as per the NOC code, and all the other requirements in that NOC code need to match with your actual job. So let's dive into and look into how to select that. So there, each of your jobs have a job title. Well, job title only cannot narrow down your NOC code. They're in the NOC code that is standardly set out by ESDC, the it's Statistics Canada. They do have the standard NOC code jobs, duties, and responsibilities. So that needs to be matching with what is actually performed at your job. So if it doesn't match, say like only the duties and responsibilities that are standardly set out, only maybe 50% of it matches, then that is not your NOC code. You got to pick something that is more closely related to your job. So, for an example, the very commonly used NOC code is the PSW or the nurse aides NOC code, NOC 33102. So, looking on to that duties and responsibilities that is already set out in the Statistics Canada website 33102. The title says Nurse Aides, Orderlies, and Patient Service Associates. And they also have illustrative examples of what are the titles that can go in your job for that. So there's even the personal support worker. See, it's not there in that title. In the title, it just says 33102, Nurse Aides, Orderlies, and Patient Service Associates. But the duties that have been stated out generally by the website does show the duties of a personal support worker. So that's how we determine that. So let's look at it in detail. So it says nurse aides, orderlies, and patient service associates assist nurses, hospital staff, and physicians in the basic care of patients. Basically, hospital staff, nurses, and physicians, and they should be assisting patients. And they are employed, they could be either employed in hospitals, nursing homes, assisted care facilities for the elderly, and other healthcare establishments. So they can be working in any of those organizations. And emergency medical care attendant are employed by private ambulance services, urgent care centers, or other health facilities. So if you are working as an emergency medical care attendant, you can be working in those related organizations as well. And if you go below, you can see example titles for this particular occupations. You can either be a healthcare aide, patient care aide, psychiatric aide, resident care aide, and orderly, nursing attendants. So these are all titles that could be applicable to your case. And there is inclusions and exclusions also mentioned in here. So inclusion is basically these are included in this, say like emergency medical care attendant, emergency medical responder, first aid attendant, medical attendant, patient transfer. And exclusion means these type of, say like emergency medical assistants, emergency medical attendant, they are not included part of this NOC code. So basically, how do we see if this is your NOC code is dive into the main duties that are mentioned in there. So main duties is answer call signals, supply and empty bed pants, bathe. So you see all these duties that are mentioned in here. There's almost 9 duties that are mentioned in here. And so most of these should be performed by the task, by the individual that is using this NOC code. However, if you actually go down to the second last point, it says may perform maintenance tasks such as assisting with the setup and maintenance of traction equipment, cleaning or sterilizing equipment, maintaining and repairing equipment, and assembling, setting up, and operating job related equipment. It's clearly saying may. It's not a mandatory task that needs to be done for this NOC code. And similarly, the second one, may transport patients between care facilities. So these two things, they are giving an optional factor in there. That could be a duty that is being done by this individual, but it's not necessary. However, the rest of the things should be part of your duties. And there are employment requirements that are mentioned for the NOC code as well. So for this 33102 NOC code, it's clearly stated out there. Some secondary school education and on-the-job training, or a personal support worker, nurse aide, or healthcare aide, college or private institutional program, or a college nursing orderly program, and supervised practical training are required. So you can see right there, it's saying are required. So it is a mandatory thing, either of those things that they have mentioned, job training or experience, though that is a requirement for this particular to use this NOC code. And it needs to be proved when you apply for your permanent residence. You need to prove that you do meet that employment requirement. And also the second point, it says completion of specialized courses such as cardiopulmonary rescue, CPR, and first aid is usually required, not mandatory, because it says usually required. When it is saying are required, yes. If it is saying may be required, usually required, not mandatory. And the last one, it says an appropriate class of driver's license may be required for medical attendance. That's also not mandatory. So this is basically the way how you narrow down your NOC code. So not by just looking at your title and saying like, hey, this is my title and this is the NOC code that comes with it. Read through the main duties, make sure you are performing the tasks that are mentioned in the main duties, and then it becomes your NOC code, and we are here to always help you out. All the best.